Hi there, this is Dr. Terry McCatton at West County Plastic Surgeons of Washington University. Today I'd like to talk a little bit about follow-up after having cosmetic breast implants. So one thing that will often come up is, so once I get my breast implants, everything's gone well and I'm happy with them, when do I need to come back? And so the other thing that often comes up is patients stating that they've heard online that once my breast implants are 10 years old, I need to get them replaced. So I'd like to address those two things. So first of all, what is generally recommended with silicone-filled breast implants is once you've had your breast implants for 6 years, we recommend that you get a imaging study, even if you feel like everything is doing well, just to make sure that there's no leak of the silicone implant. And that's because usually when silicone implant leaks occur, neither the patient nor their surgeon is actually going to be able to clinically tell that there's a leak. So very often at that point, we'll order ultrasounds, sometimes MRIs, to have a look and make sure that there's no leak. Assuming that that's clear, we'd recommend repeating that process every several years. Now, the other thing that comes up is, do I need to change my implants out after 10 years? And what we have found is that the vast majority of women don't need to. We typically recommend only changing out your implants when you're having an issue. So if you've had an MRI exam of a silicone breast implant and you've seen that there's a leak, yes, we would recommend removing and possibly replacing those implants. If you have a saltwater implant and it's leaked, you don't need any imaging for that. Essentially, if a saltwater breast implant leaks, the breast will very rapidly, like within a day, dramatically deflate. Another reason why you would want to have your implants replaced is the development of something called capsular contracture. So when a breast implant is placed, a natural scar tissue forms around that breast implant known as a capsule. That's a normal event, and that process literally starts within hours of placing a breast implant and develops quite quickly. That's a normal event. However, if the breast implant capsule becomes thicker, harder, causes distortion of the shape of the breast implant or pain, then that becomes a problematic capsular contracture. And that, along with leak, are the two main reasons why a breast implant may need to be replaced. So then, what would be another reason why a breast implant may need to be replaced? And that would be because it's in the wrong position, potentially causing discomfort. For some reason, a patient doesn't want the implants anymore. Those would be other reasons to remove the implants. Finally, there is a very rare form of cancer associated with breast implants known as breast implant-associated anaplastic large cell lymphoma. This is associated with textured surface breast implants. So, if a patient was to develop a sudden swelling of the breast due to a fluid collection or a mass in the breast, then you should absolutely make an appointment to see the plastic surgeon who put those implants in for you and get that checked out. Now, it's also important to know that breast implants do not increase or decrease your risk of getting breast cancer, but the incidence of breast cancer worldwide and in the United States is that 1 in 8 women will get breast cancer, and 85% of women who've had who get a breast cancer do not have a relative who had breast cancer. So you need to keep on getting your mammograms, and you need to keep on checking for this. This breast cancer is not associated with your breast implants, but it can certainly still develop. Hope that is useful information. Thank you.